board again. Okay. Okay, on admissions. Okay, so you are concerned. You are reviewing the discharge. You are reviewing the discharge planning for this population. Okay, so here's a question. I'm going to give you which three of the risk factors for uncontrollable type 2 diabetes are most important to consider when planning for care. Okay, so here's your options. Family history, high blood pressure, history of asthma, sedentary lifestyle, pregnancy, or obesity. What would you guys say?
Obesity.
That's definitely one of them.
Family history, maybe.
Family history.
Say that. Pardon me?
Family history.
One more time, say that. Family history.
History.
Yes, yes. Okay. What about a sedentary lifestyle?
Yeah, sedentary lifestyle.
We're talking about risk factors. So actually, I'm going to take that back. Family history is more important with the type 1 diabetes, right? Family history is not a correct answer for type 2. Okay. High blood pressure, wouldn't that be a risk factor?
In
Yes.
the pregnancy.
Pregnancy is not one of them. Okay. The answers are high blood pressure, sedentary lifestyle. We know that that is for sure a risk factor, right?
Right.
And
Obesity.
obesity. Which of the three, what are the three important risk factors? Okay. Let's go to the second question. Okay, here's some more information now. We're building on this now. The standardized discharge care plans for adults with uncontrolled diabetes, they have not been updated in 5 years. During discharge discussions, your clients have shared concerns that are not addressed in these plans, including challenges to managing their diabetes after they return home. Okay, so there's some additional information. So here's the next question. What would you need to know about this population with uncontrolled type 2 diabetes to help them plan for their care after discharge? And it's select all that apply. So here's your, so what do we need to know about the population? Okay, educational level, current living arrangements. Well, let's go by each. What about educational level? Is that important?
Yes.
Yes.
Why is that important?
This is the way they understand the care they need. If they do not understand your instruction as a nurse,
Right.
there won't be a good proper management on their ends.
Right. What if there's a language barrier? What do you do?
Get an interpreter.
Mhm, mhm. Okay, so these are the important things that we need to know about our client. What about current living arrangements? Do we need to know about that?
Yes.
Yes.
Why?
It's possible that they might live with someone who is possibly diabetic or has high blood pressure, so that can affect what it is that they're cooking and what's brought in, or if they're even able to use the refrigerator, because if they're just like possibly homeless or transitioning, they might have to get their food as they come and go and not access the refrigerator.
Okay.
Just
What if
planning and cooking their meals.
Yeah, exactly. Yeah. Is there somebody there to help them make healthy choices for food? Is there somebody there to help them prepare healthy eating meals? So current living arrangements are really important. We do want to know about that. What if they're living alone and they can't cook for themselves? They can't shop for themselves. What if there's a language barrier and we have somebody in the home who understands the language and can help interpret for them? So yes, current living arrangements is extremely important. What about their parents' health status? Do we need to know about that?
No.
No, not for diabetes too. We really don't. What about their occupation? Is that important?
Yes.
Why? Why?
Are they sitting down for long periods of time? Are they super active?
Mhm.
How do we need to manage it?
Or do they work in an environment that's very sedentary and they sit at a desk all day? Right? What about preferred language? Well, we kind of answered that. Yes, obviously that's important. We need to make sure they can understand what we're teaching them. And then what about number of children? Does that matter?
No.
That does not matter. Hey, a little bit more information. As you look at the discharge plans, you recognize that the focus is on access to medication and having follow-up appointments. Remember, this is a case study that's out in the community. Okay, this would not be for a hospital setting. These are the kinds of things you're going to have to problem solve with this population potentially out in the community. So now you recognize that the focus is on access to medication, having follow-up appointments. So the question is, in addition to medications and follow-up appointments, which of the following would be most is capitalized, which would be most important to address in the discharge plans? Okay, here's your choices. Sorry, hang on. Blood glucose monitoring, high fiber diet. No, I'm sorry. Blood glucose monitoring is A. High fiber diet is B. Family history is C. Foot care is D. What would be the most important topic to
Glucose
address?
monitoring.
Right, why?
Because we're addressing the diabetes itself. So they're gonna
Right.
monitor the and where they need to obtain the glucometer and the
Exactly.
supplies for it.
Exactly. What's their diagnosis? Diabetes. What's the primary intervention for diabetes? Knowing what your blood sugar is. Right? Okay, next question. We're going to add a little bit more information. Now you're interested in how hospitals address social determinants of health. So before I tell you the question, what are determinants of health? What are social determinants of health? What does that mean? Determinants of health are fancy words for what kinds of things determine how healthy you are or how not healthy you are. And then add the word social to it. So what are we talking about here? Poverty levels, access to health care, right?
Finance.
Social, environmental determinants. Go ahead. What are some others?
It's exactly what you said, financially too,
Mhm.
poverty.
Mhm. Access to care, access to quality care, education level. All these are transportation. So what kinds of things in the environment socially help determine whether you're healthy or not healthy? So the question is, who is the best person to contact to find out about the hospital's involvement in community care? Okay, so meaning social determinants. Who's best to help you identify what's out there in the community? What are resources for people with diabetes? Chief executive officer, chief medical officer, client advocate, or director of social work.
Director of social work.
Why?
So
Why?
Because
Because it's a part of their job to locate resources to help their client, not necessarily just the community.
Yep, that's excellent. The social worker, that's their scope of practice, right? Knowing what's out there in the community for resources for people with all different kinds of diagnoses. Okay, so to add more information now, the quality improvement director meets with you and the director of social work to discuss your concern about community risk factors for diabetes. You present the hospital data showing the increasing trend in clients admitted with the primary diagnosis of diabetes over the past year. And then you start to discuss what this data means for the hospital and its community. So the issue is now we have an increase in hospitalizations with a primary diagnosis over diabetes. So the question is, where would be the best? Best is highlighted. So this is a priority question. Where would be the best place to get valid and reliable data to determine if diabetes has increased in the community over the past 5 years? Okay, so 5 years means we have to go way back. Okay, so your selections are hospital diabetes registry, local health department, local medical association, local nurses association. Well, you should be able to rule out C and D right off the bat. So pretend this is an exam question, right? The local medical association, the local nursing association, they're not going to have that kind of data, right? So you can throw out those two answers right then. So now we're down to hospital diabetes registry and local health department.
The
What
health
is the
department?
health department?
Right. And why can you gather what's important? Let me rephrase that. The reason why you can go to the local health department is because they gather previous data and keep it. Okay, so the local health department, you can go and get years and years worth of data. So that's exactly right. Hospital diabetes registry. I haven't heard. Do hospitals have diabetes registries? I didn't. Have you guys heard of that? I haven't. So the local health department's the right answer. Okay, next question. No more data right now, but here's the next question. Which data would most is highlighted, which data would be most important to determine if diabetes is increasing, is a increasing health problem in your community? Okay. Hang on a second. Okay. So here's a couple of terms that you should be familiar with. Before I read the answers, you should be, and this is for note taking, you should be familiar with what is the difference between an incident rate and a prevalence rate. Anybody know the difference between incidence and prevalence?
Yeah, incident is more like, the easiest way to say it is more so like one is acute and one is chronic. So incident would be acute as it just happened like immediately. So that's an incident. It's more so connected to an event versus the others more so prevalent. So it's like how prevalent this disease is in the community. So it's more so chronic.
Wonderful. Does everybody understand that? Excellent, Devin. So the question then, with Devin explaining that, is which data would be most important to determine if diabetes is an increasing health problem in your community? So A, the diabetes incident rates, B, diabetes prevalence rates, C, obesity rates for adults with diabetes, and then D, obesity rates for children with diabetes. Well, they're not really asking about obesity, right? So we could certainly rule out C and D, correct? So they're asking about what would be the most important to determine if diabetes is an increasing health problem. So are we looking at incident rates or prevalence rates?
Prevalence rates.
Prevalence, if it is chronic.
We're looking at incidence rates, right? No, I'm sorry. We're looking, no. Yeah. We're looking at incident rates because we're looking for current data, right? What is the incidence? So the question is, what is the most important to determine if it's really a problem in your community? Well, you have to look at current incidents. 4 per 100, 10 per 100.
Wouldn't you want to also look at the chronic to see whether or not it's increasing?
You could, but that's not what the question's asking. The question's asking is, in the here and now, what's the most important way to determine if it's actually increasing right now in your community? So that would be incident rates. Does that make sense? Whoever asked that question, does that make sense? They're
Yes,
not
it does. Thank you.
okay. Next question. To be able to better understand factors influencing the occurrence of type 2 diabetes in your area, which of the following data would be most highlighted, most helpful? Okay, so now we're talking about factors influencing the occurrence. Okay. Sorry. Okay, here's your selections. Remember, in the question, it said in your area. Okay, so that tells me it's local, right? So the first answer is state level diabetes prevalence rates by age, educational level, socioeconomic status. Are we wanting state data right now?
No.
No, it asked you in your area. The next selection B is local community diabetes incident rates by race, ethnicity, gender, socioeconomic status. C is national data on diabetes rates. Okay, so what's the right answer? State, local, or national? What do you want? What information do you want?
Local.
Local, right. Okay, so after reviewing your discharged clients' records, you now notice that 8 of the 10 live in the same zip code. Okay, so the question now is, which risk factor for poorly controlled diabetes is better addressed at the community level than that at the individual level? So if you have 8 to 10 people living in the same zip code, something's got to be in common, right? So here's your answers. One second, I get to answer A is lack of recreational space for physical activity. Could that be in play? That's everybody in the same community? Because remember, this is now a group within the same community. So another answer is generational family history. Is that going to matter with a group?
No.
No, because we're treating the group as one now, right? Lack of community knowledge of healthy diets? No. And what about gestational diabetes? You can rule that one out. That has to do with pregnancy, right? So you're looking for a risk factor that is potentially poorly controlled in an area that has lots of 8 out of 10 live in the same zip code. So the correct answer would be lack of recreational space and physical activity. Can you jump to that conclusion? That maybe that's an issue for the whole group?
Yes.
Does everybody understand where I'm coming from there? Generational family history, if you're looking at this group as a group, then generational family history is individual. Lack of community knowledge on healthy diets, that's individual. And then gestational has to do with pregnancy. So the only logical answer is lack of recreational space for physical activity. That potentially is the risk factor. Okay, just a couple more questions. So we're going to add some more information. The director of social work now introduces you to the county public health nurse to talk about your findings. Public health nurse tells you that many in the zip code you identified report not feeling well, not feeling safe to walk and exercise in the area. The neighborhood is very dense with apartment buildings, many busy streets, and malls. Okay, so there's some additional information. Okay, so the county has been working on trying to create safe spaces for exercise for county residents. Public health nurse asks if you would like to go to the next board meeting and present your concerns. Okay, so the question is, which is the most highlighted significant evidence you could present to the board to help them with their deliberations? Okay, A, county and state health data on diabetes prevalence. Hospital data on diabetes prevalence in clients in the zip code. Client stories about managing diabetes in the community. And in X, you could do an explanation of the consequences of uncontrolled diabetes. So remember back early, what were we concerned about? We were concerned about the readmissions, right? So what data would be concrete that he or she could present at the next board meeting? Okay, hospital data on diabetes prevalence in the clients from the same zip code. Right? So do you understand why that would be a good answer? County data and state data on diabetes prevalence, yeah, that's good, but it's not the most significant evidence we have, right? What's costing the community hospital readmissions, right? And remember, this whole case study is about reducing hospital admissions, right? So the correct answer is the most important information to present to this board is hospital data on diabetes prevalence in clients from the zip code. So again, going back to Devon's two definitions, this would be an example of chronic, looking at it from a chronic standpoint. What is the prevalence of it? Okay, after meeting with the board, after the meeting, the Board of Health decides to work on developing a walking path at the local high school that's accessible to the public. Great, that's awesome. Which of the following individuals needs to be involved in planning the walking path? Okay, select all that apply. Okay, do we need the school district superintendent involved?
Yes.
Okay, do we need the public health nurse involved?
Yes.
Sure. What about primary healthcare providers? Do we need them?
Not really.
Nah. What about PE teachers? Do we need them? No. What about the local residents? Do we want to get their input?
Yeah.
Sure. What if the walking path is too close to their backyards, or I don't know, the noise level? And then what about high school principal, since it's being built on his property, on the school's property?
Yes.
Want his input? Yeah. So we want the school district superintendent involved, we want the public health nurse involved, we want the local residents involved, we want the high school principal involved. If you're going to take on a intervention to help with this, local public health issue of limited access to, public places to walk and get exercises, then we need all the important members of the team at the table. Okay. Then the last question is, 1 year later, the public health nurse reports to the RN that the walking path has been established. Okay, the last question is, what is the most important action the nurse can take? What is the most important action the nurse can take in the hospital to use this information to help clients? So, how can you use this information? A, announce a new walking path at the next unit meeting. Well, that's not really going to help patients. Report the new research to the new, it's asking for the most important. Sure, you could let everybody know about it. Report the new research to the social work department. Sure, that would be helpful. Put up posters in the hospital about the new walking path. Sure, I guess that would be helpful. The correct answer is D, because it asked you what is the most important action. And remember, way back at the beginning on question like 2 or 3, it talked about the health plan hasn't been updated in 5 years. So answer D is revise the discharge planning documents to include the local physical activity resources. Does that make sense? I mean, all those answers are okay. All those answers are fine, but almost all those questions had a most, first, a priority word in it. So all those answers were good. But what would be the most appropriate answer is, if you remember back to the beginning, we have to revise remember the discharge process hadn't been updated in 5 years. Does that make sense? So that takes you through an issue in the community takes you through your whole nursing process, from assessing what the issue is all the way down to evaluation. Okay, and that's a really good example of all the steps that would need to be taken for one issue in the community. For the original problem was readmissions to the hospital for type 2 diabetes. So I don't know, is that helpful to talk through that, a case study like that? Because as a public health nurse, community nurse, you're going to be going through all those steps. Okay. Questions? No questions? Did you like that case study?
I did.
Yeah. And thanks for everybody that provided their input. Yeah, I mean, you have to think through in the community setting. Okay. So it's 2:30. We didn't take a break, so please take a look at your review calendar, see if you can get to any of the live reviews today. Exam is next week. I'll be sending recordings as I get them throughout the week and weekend. Okay. And then after doing your own due diligence, like I said earlier, after you're doing your studying due diligence over the weekend or early next week, if you're having issues with any of the concepts, please reach out and let me know. Okay.
Thank you.
Thank
Well, I
you.
hope you guys have a really good rest of the week. And then please reach out if you need anything. Okay.
Thank you.
Thank you.
All right.
you.
Talk to you later. You're welcome.
Thank you.
Bye. I'll stay on if anybody has any questions.
Oh, Professor Marvel.
Yeah.
I forgot to ask you, as far as the exam setup, are we doing it like last term where we have to have a whiteboard?
Yeah.
We're gonna.
Yes,
Okay.
you do have to. This term, you have to have a whiteboard. And the other thing you just made me think of is I need to send out your groups,
Okay.
because you have your assignment due next week. So I'll send out the groups today. I'll get
Okay,
those done
cool.
today.
Thank you.
And you can start working on that. It's a pretty easy assignment. It shouldn't take long, but I'll get those groups out today.
Okay. Have a good day.
Hey, thanks. You too. Anybody else have any questions? Hey, Jacob.
Hi. Actually, hey, so I was just curious.